Hello there, I'm Dr Phil Hammond. Welcome to embarrassingproblems.com for our whirlwind tour of the penis. Now this is the penis part 3, the penis part 1 and the penis part 2 are available on this site, so you can download, have a look at them now. In the penis part 1 we talked about problems around the head of the penis and the foreskin, tight foreskin, circumcisions, the importance of good foreskin hygiene even. In the penis part 2 we talked about lumps and bumps and sores, sexually transmitted infections, the importance of A, using a condom to prevent infections, and B, seeking help, going down to a sexually transmitted infection clinic if you've got any difficulty passing urine, or if you've noticed any lumps and bumps, or noticed any pus or discharge that isn't normally there. In the penis part 3 today we're going to be looking at size, shape and firmness. I'm actually going to talk about shape before I move on to the tricky problem of size. Now, a lot of men have a bit of a kink in their penis when it's erect, and if it's just a slight kink, it isn't causing you too much problems, it's not hurting, you can have sex without any difficulty, that's fine. But if it gets to the shape where it's bending so much you can't insert it easily, or it's causing you pain when you have an erection, and the bend could be up or down or sideways, it's worth going to see a doctor who'll probably refer you to a urologist. This condition is called Peyronie's disease, and it can be fixed with an operation. It's due to a sort of a fibrous plaque on the shaft of the penis that sort of scars and makes the penis bend, and you need to remove that plaque. Quite a complicated operation, but it can be done reasonably successfully. The other thing you may notice is that most men have a hole at the end of their penis, on the end of the glands. Some people have a hole on the underside, so they're sort of peeing on their shoes when they stand up to pee. Often they find it much easier to sit down. That's known as hypospadias. Sometimes the glands of the penis can look a bit abnormal. Men get very embarrassed and shy about this. I've seen men in their adulthood who have hypospadias that hasn't been treated because they've been too embarrassed to go and show anyone. They spend all their adult lives sitting down to pee. So if you notice anything isn't quite right there, the hole is on the underside and it seems to be more open than it should be, go and see your GP again. Quite a complicated surgical procedure, but it can be fixed in the right hands. You want to go and see somebody who does lots of these procedures, generally a plastic surgeon, and it's a 2-stage procedure to return the penis to its normal anatomy. But make sure you ask around and make sure you're seeing a specialist. Now, does size matter? Well, the honest answer is it probably does to some people. Some women and some men prefer a big one. Most people prefer a clean one and a sense of humour. And actually the unerect penis, the soft penis, is often quite deceptive. Most penises end up from about 5 inches onwards, sometimes 7, 7.5, 8 if you're lucky. But actually the important, most sensitive parts of a woman are on the outside, within the first 3/4 of an inch, if you know where to find them. So provided your penis is that long, or your tongue is, or your imagination is, then often you shouldn't have much problem. If you're absolutely sure you want to have a bigger penis, there isn't a simple way of going about it, and it is fraught with potential hazards. The most common non-surgical use is a penis expander, a vacuum pump, similar to the vacuum pumps people use when they can't get an erection. And it's a bit like training a muscle. You use it half an hour a night, you build up, but you mustn't have it on for too long. If you put one of these pumps on for too long and you pump up the erection and you fall asleep with it, you could end up with a gangrenous penis, which isn't a good look. So be slightly wary of that. There's the vacuum pump, or the surgical operations. One of them takes the penis. Now normally the penis comes out like this, and about 1/3 of it is anchored inside your body, bound by ligaments. So there's a lengthening procedure where they sort of pull the bit that used to be inside down and they anchor it lower down. The danger of that is you lose a bit of anchorage, so you can end up with a slightly longer penis that is a bit like a windscreen wiper, which doesn't work as effectively. The angle of the erection isn't quite so good. To get some thickening, what they do is they take some fat, suck up some fat from somewhere in your body and they squirt it in under the penis. Now that's actually more successful, but the trouble is it's hard to get the fat to stay where it should do. So once you start having sex, you get a bit of a snowdrift effect and you end up with a penis that looks a bit like a turnip, with a big cherry on top and thin, and then all the sort of fat drifts to one end, and you've sort of got to massage it out again to make it rather uniform. So not always a huge success, far better to develop a sense of humour and a sense of an imagination, and to talk to your partner, find out what she likes. And it probably won't be a penis the size of a baby's arm holding an apple. Okay, now let's talk about the erection itself. A lot of animals, quite lucky, they have a bone in their penis. They don't have to worry too much about getting an erection because it just happens. Now for some reason humans haven't evolved a bone in their penis, probably because that's all we do all day. If men could just get an erection just like that, it was there all the time, that's all we do, we never achieve anything. We never find cures for cancer, we never go on summer holidays, we just spend all our time having sex, and we'd probably get a bit sick of it. So instead we've evolved this incredibly complicated mechanism of hormone mechanisms in the brain and pathways and chemicals down below to suddenly give us an erection. And it's not that uncommon. Maybe 1 in 10 men, slightly more common as you get older, have problems having an erection regularly. We all at some time will have problems getting an erection. If you've had too much to drink, you're a bit stressed, you're a bit tired, it just isn't going to happen. Or we've already had sex a couple of times that day. But about 1 in 10 men on a regular basis with erectile dysfunction. We all know there are tablets now that can help this. Viagra, probably the most common one, but other tablets are available. And it's horses for courses. Some people find some of the tablets, Cialis, Levitra, help them more than others. But they're all much of a muchness. They all seem to work pretty similarly. No one's done head-to-head comparisons, if you'll excuse the pun, on these 3 drugs. So the drug companies make big claims about which is better in which circumstance. Actually, it's a case of trying them out. In the English NHS, you can only get them if you have certain medical conditions, which seems a little bit unfair. And even if you do get them on prescription, we tend to ration you to once a week maximum. So a lot of people find themselves buying them, but if you do buy them from a reputable dealer. The trouble with getting them online from anyone is you end up with a bit of horsehair or rat poison, or could be anything, your little blue diamond. So try to go to a proper chemist if you're buying it online. There are other means of getting an erection. There's the old vacuum pump, similar to the pump that you use to train your penis to get bigger. You pump, 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 pump up. Your partner can choose small, medium or large, which is quite fun. But rather unusually, the penis ends up being stone cold, which is a bit of an acquired taste. You think, oh, I'm not used to that. And then you put one of these on the end. This is known as a cock ring or a pubis ring. Very important if you're using one of these that you choose one with handles. If you just choose the ring, you may not be able to get it off. And that's like a wedding ring on a septic finger. That's a very embarrassing visit up to casualty. So always choose a cock ring or a pubis ring with handles on it. Some people just use these to sustain the erection. But ultimately, I think the important thing is to remember that making love is all about communication. It's all about the mind rather than the body. It's all about looking at each other and breathing in unison and talking to each other about what you like. And if you do that, you sort that out, generally size doesn't matter at all. Companionship and love and time together is what matters. If you want to find out more about embarrassing problems, go to embarrassingproblems.com. If you want to find out more about me, drphilhammond.com is the website. Thanks for watching.